Today we have an important topic, and that is nutritional disorders. These are disorders which are caused due to overtake deficiency of nutrition. So basically they are deficiency disorders of nutrition, that is carbohydrate, protein, fat, vitamin, mineral, other water. First of all, we have marasmus. It is a disorder caused by deficiency of food or protein, energy, malnutrition. So it is a PEM disorder, PEM, and it happens in infants of age 1 to 2 years when they do not get sufficient mother's milk and weaning diet. Such infants are often provided with very diluted cow buffalo milk. Marasmus babies have emaciated body with shriveled appearance, thin face, sunken eyes, shriveled thin and dry skin, protruding ribs, reduced digestion, frequent diarrhea, low weight, little growth, replacement of tissue proteins, and poor mental ability. So their body is like this. Okay, so this is marasmus. So it is a PEM disorder. Now, if we take the second, that is Kwashiorkor. So second, we have Kwashiorkor. It is a protein energy malnutrition disorder. It occurs again in children of age 1 to 4 years. So again, it is a weaning and post-weaning due to constant reduced protein availability. This can be due to many factors. In fact, if we take those, the reasons can be: the first, we have the early stoppage of breast milk. So if we take the reasons, so first is early stoppage of breast milk is not given, or late supply of supplementary food, it is given lately. So food is given lately. Then we have over diluted milk, that means more of water is put in milk. So we have more of water in milk. And the fourth one is that maintaining children on cooking water of cereals. So cereals, their water is taken, then maintaining children on them. So Kwashiorkor child has a Microcytic legs. It is a important symptom. Microcytic legs, protruded or pot belly, botchy skin, wasted muscles, anemia, edema of certain parts, and repeated diarrhea. So a lot of deficient problems are here in Kwashiorkor. Now, if we go on to take these different disorders related to nutrition, with third, that is obesity. Now, obesity is a luxury nutritional disorder. So it is LND disorder. So it's a luxury nutritional disorder caused by greater intake of food than the requirement of the body. It is quite common in persons having higher intake of sweets, carbohydrate rich food. So if we take these elements, so we have sweets, we have carbohydrate rich food, we have fried articles. The fried food is taken sometimes, so we have fried food, and then fat rich food, absence of refuge food. So absence of refuge is very important because we have low refuge content and we have low motility in intestines, so movements are reduced. So we can say obese persons are overweight with excessive accumulation of fat, movements are reduced, there is a risk of diabetes, osteoarthritis, gallbladder stones, high blood pressure, cardiac problem. And then we have the reasons for overeating. There are some reasons. First is psychogenic, then physiological, and we have two reasons in fact. One is genetic, and then it can be developmental. So we have genetic reason and developmental reason also. So there are problems, with obesity, how man becomes obese. So these are, in fact, in adulthood mostly, if we take a lot of food. Now, moving to the another disorder, that is hypercholesterolemia. Hypercholesterolemia. This is the fourth nutritional disorder we're taking. So now fourth one, this is hypercholesterolemia. Okay, it is characterized by high blood cholesterol due to higher intake of cholesterol-rich eggs, red meat, butter, and ghee, or reduced biotin intake. Cholesterol gets deposited on the walls of blood and vessels, making their lumen narrow and velocity per. This increases blood pressure. So blood pressure increases, which is actually called hypertension. So it leads to other cardiovascular disorders. So if we take blood pressure, it increases because of a lot of factors they are occurring. And finally, there are cardiovascular disorders. Most of them are related with cardiovascular system. So we have problem in heart, we have problem in vessels, we have problem with body. Now, taking one more is the rickets. The disorder is due to deficiency or asphyxiation of bone, and is leading to their bending and swelling of joints. In fact, they can knee, wrist, and elbow. So three joints, get they bend and get swollen. So joints get swollen. Knee, we have wrist, and we have elbow. That means all three important joints on legs and on arms. It occurs in children of 6 months to 2 years. So if you take this 6 months to 2 years, when their diet is deficient in vitamin D, so there is a deficiency of vitamin D in effect, and the calcium, phosphorus. So three important factors. This is rickets. Okay. Now we can take another that's relative with this. That's called adult rickets. That's exactly called Osteomalacia. So we have sixth one. There is Osteomalacia. It's adult rickets. So if rickets happens in children, this osteomalacia happens in adults. The disorder occurs in adults when their food is deficient in vitamin D1. So again, it is a deficiency of vitamin D1, and there is calcium deficiency or phosphorus. Osteomalacia, so that's why it's called adult rickets. So adult rickets. Bones of vertebral column become weak. Pelvic and other bones bend and become soft. So this is important nutritional disorder to be studied. And now let's take another nutritional disorder. There is seventh one. There's xerophthalmia. So we have xerophthalmia. It's actually vitamin A deficiency disorder. So if we take this disorder, this is vitamin A disorder, deficiency disorder, which is caused by stoppage of lacrimal activity. Cornea and eyelids become dry and ulcerated. It leads to swelling of dry eyelids and opacity of cornea. So xerophthalmia, if untreated, leads to blindness. So definitely it will lead to blindness. Okay. So the importance to take vitamin A. Now we have one more, which is the same, related as if we take the deficiency with this xerophthalmia. That is we have eighth one, and that's night blindness. So eighth one, night blindness. This is called nyctalopia. So this is called night blindness, nyctalopia. It is a disorder deficiency of vitamin A. Okay. So if we take this name, nyctalopia, so vitamin A is again deficient here. Results in deficiency of rhodopsin or visual purple. Now later impairs the ability to see in dim light or night. So we are not able to see in dim light or night, and rods gets affected, not cones, rods gets affected. So definitely vitamin A deficiency, important one. Now taking another nutritional disorder. That's ninth one. We have beriberi. We have beriberi. Beriberi is debility produced by deficiency of thiamine. So it's a thiamine deficiency disease, as during excessive intake of polished rice it results in loss of appetite, anorexia, weakening of muscles, fatigue, poor digestion. So we have anorexia, that's actually loss of appetite. And we have palpitation, we have mental confusion, slow reflexes, body rigidity, neuritis, impact. Okay, so many. There's an inflammation of peripheral nerves, weakening of muscles, paralysis, progressive edema. So depending upon the system affected, this beriberi can be of many types. So if we take the system affected, we have types of beriberis. So beriberi have 5 types. In fact, we have dry, we have wet, we have mixed, we have cardiac, and finally that is cerebral. So these are 5 types of beriberi. Okay, now this is important because this is a thiamine deficiency. Now let us take the 10th one, the 10th nutritional disorder, and that's pellagra. So we have 10th, that's pellagra. The disorder is due to deficiency of vitamin that's called nicotinamide. So nicotinamide deficiency. It's called niacin, nicotinic acid. So it's nicotinamide, nicotinamide. It is characterized by extra pigmentation, thickening cracks, and eruptions in exposed regions of skin. So that's what's called dermatitis. There is a glossitis, there is swollen tongue, canine black tongue disease. It's called canine black tongue disease here. We have swollen lips. We have peripheral neuritis also, irritation, diarrhea, and dementia. And this dementia is loss of memory. So now we have 10th disorder, 11th in fact, that is scurvy. It's called Sailor's disease because for the first time some people who were sailing in the sea got deficiency of vitamin C and got the characteristics of disease. This is called Sailor's disease. Now it is vitamin C, ascorbic acid deficiency of that. So deficiency leads to scurvy due to reduced connective tissue formation characterized by bleeding gums. Now is looseness and falling of teeth happens, fragile blood vessels, fragile bones, painful and swollen joints, and emaciation and slow healing of injuries. Now we have 12th one, that is chelosis. So chelosis, we have the inflammation and cracking of mouth corners due to riboflavin. So it's actually vitamin B2 deficiency though. So there is a mouth corners we have problem, there is cracking in mouth corners, and so it's a riboflavin B2 deficiency. So this is B2 deficiency, so please remember. Now taking the last one of important, this is anemia. Anemia is reduced iron content, or RBCs is actually when RBCs, erythrocytes, are reduced in concentration, in amount in blood. That's anemia. So it is disorder actually. So we have anemia in which hemoglobin, so it's a disorder in which hemoglobin content of blood is low due to either few red blood corpuscles or their hemoglobin content is low. It results in weakness, tiredness, reduced learning ability, repeated infections, and eye death during childbirth. It has 3 types in fact. One is microcytic, most common due to iron deficiency, leading to fever and smaller erythrocytes with reduced blood, this hemoglobin. Okay, so there is iron deficiency. Second type, that is megablastic, macrocytic, due to fewer abnormal red blood corpuscles caused by deficiency of folic acid or B12. So B12 is folic acid, B12 is absent, reduced. Now we have third, that is pernicious. The third one is pernicious anemia due to production of hemoglobin pre-immature RBCs caused by B12 deficiency. Again we have B12 deficiency as a result of deficient intrinsic factor. Okay, so again, so we have B12, here is anemia, it is ferrous deficiency, iron. Here we have folic acid, again folic acid, B12 deficiency. If we differentiate all the three, so this is anemia. Sometimes we go on to know different types of anemia also, but these are nutritional. We have one more, that is sickle cell anemia. That is in fact a genetic problem. So sickle cell anemia and thalassemia, or genetically controlled, sickle cell anemia and this. So anemia also occurs due to excessive blood loss. The same is called post-hemorrhagic anemia. So we have sickle cell anemia, then thalassemia. These are genetically controlled problems, in fact. Now we have one more, when there is excessive loss of blood, that can be also called anemia, but that's what's called the post-hemorrhagic anemia. So excessive loss of blood causes loss of blood, that means deficiency of RBC, deficiency of what's exactly called anemia. That problem is called post-hemorrhagic anemia. So hemorrhagic means when you are losing blood, and after that there is a problem, it's anemia, that is post-hemorrhagic anemia. So these were some important 13 types of nutritional disorders present in human beings if we don't take and don't care on the diet. Now the last point which I want to put from my side will be a big thank you for watching this important lecture in biology. Thank you for watching.